If I were a patient with a terminal illness, there are several things that would be important for me to know. I would want a physician to ask me what I fully understood about my disease, and if then there were facts that I didn't have, I would want to be fully informed by my physician to make a decision on how aggressively or not aggressively I'd want to be treated. That would be very important. Also, from my experience as a physician, I see sometimes physicians talk too much and listen too little. So if I were a patient with a terminal illness, I would want the physician to ask me such questions as, what are my fears? What do I fear about my illness? A lot of times I feel they're suppressed. The patients don't outwardly discuss those with family or friends. And so I'd want to tell the physician my fears, but I would also want to tell the physician my priorities. What is important to me? Again, from my experience as a physician, I note that some patients' priorities are not what I would suspect. As a physician, you feel priorities might be pain management, it might be treating constipation or nausea or vomiting, but sometimes it's a totally different event. And if I were a patient under those circumstances, I may want to see my granddaughter, I would want to live long enough to see my granddaughter graduate from high school. I may want to go to a college football game that I'd never gone to. Again, I would want to have the opportunity to prioritize what's important to me to the physician, but also express my fears. If I were terminally ill and I felt that the chance of a significant recovery or improvement of my symptoms was impossible with aggressive management, such as hospitalization or CPR, I would refuse it. I would want comfort care. I wouldn't want to be in pain. I would want, if I were short of breath, to be treated for that. Any other somatic symptoms that I had, I would like to be treated. I would want to be surrounded by loved ones, and I'd want to be in my home when I was treated, not in a hospital setting.